gonna steal one of those chairs. Put it over there, because I might be in and out. I think we have everything.
Good afternoon, everyone. Just want to get everybody's attention before we start. If everyone doesn't mind to turn their cell phones on vibrate, that would be great. Sometimes it's really distracting for our presenters to have a cell phone go off. I understand if it's an emergency, if you don't mind just going out the door and taking the call, that would be great. So setting it on vibrate or silent, we would greatly appreciate. My name is Sharice Kiles, and I'm the Community Outreach Coordinator for Summerlin Hospital. I want to thank everyone for attending today's panel presentation on the importance of balance, and there you go. So today's panel speakers are Dr. Maribel, who is with Ear, Nose, and Throat Consultants of Nevada, as well as Dr. Hitzman from Drs. Coppolau and Giriskin, Doctors of Optometry, Rob Cruz and Van Lee, who are with Summerlin Hospital's Pharmacy, and Lisa Patterson and Ratia Vong, who are with Summerlin Hospital's Outpatient Therapy. We will have a Q&A session after all of our panelists have presented, so please hold your questions until the end. I'm going to come around with a mic and we can have you ask your questions and make sure that we facilitate all questions that you guys want to ask. But the only time we're not going to do that is after our first speaker. So after Dr. Mirabel speaks, our ENT physician, we're going to take a Q&A for her because she does have another commitment at 1 o'clock that we need to get her to. So again, thank you for joining, and please welcome our guest panel speakers.
Hello, everybody. So my name is Christine Maribel. I'm an ENT here in town. I'm from Florida, then Texas, and in the military thought I needed to hang out in Vegas for a while. So I came here, got out of the military in 2017, and then joined the practice here in town. And I'm just really glad to get out of the office and meet some people. So thanks for having me. I am not a tech person, so my apologies if I go backwards when I should go forwards and so on. We're going to try to get through this. So I wanted to just spend a few minutes kind of talking you guys through exactly what balance is, what systems systems are actually involved in keeping us upright and making sure that we know, or that our brain knows, where we are in space. And then some common causes of balance disorders and some things to look for and some treatment options. So here we go. Alright. So in general, what is balance? So balance is incredibly complicated. In our specialty, people come to us, they often assume that balance issues always mean there's something wrong with your ear. But to actually kind of stand, just to do what I'm doing right now and stand here, is really a miracle. I mean, it's an incredible system, and we'll hear a lot from everyone else on the panel as to why that is, but basically we need several things. Number one, musculoskeletal strength. So we need to have enough core strength to keep us upright. We need enough strength in our hips and legs to keep us upright. And we need to have good feeling in the bottom of our feet so that the feet can feel the kind of contact with a stable surface. Obviously the inner ear, that's my world. The inner ear is what helps tell the brain whether you're moving forward or back, or whether we're rotating. So that's kind of its role in all of this. Obviously our heart, I always say if the ticker isn't ticking, nothing's working. And so if you're not getting enough blood up to the brain and so on, then everything just starts to go downhill. So I'm a big lover of making sure the ticker's ticking right. And then obviously neurologic, everything has to eventually make it to the brain. The part of the brain most responsible for balance is in the back of the brain. It's called the cerebellum. And all of these systems feed into that, and it's like a supercomputer that processes it all and figures out that we're currently standing in a room that's not moving, I'm not on the roller coaster ride, and so on. And then obviously vision. And my thing is, have you ever tried going to the bathroom in the dark? You feel a little unsteady. The room hasn't moved, nothing's changed, it's just you've taken your eyes out of the equation. And as we'll hear from our optometry colleagues, vision is paramount for balance, and we often compensate for weaknesses in other systems of balance with our vision. So when people come into the office to see me, the common complaint is I feel dizzy. And that can mean a million different things to each individual. So for some people it means that the world feels like it's moving when it isn't. So think of like you get off a boat and you still feel like you're kind of swaying. Or you get up in the morning or move too quickly and the room starts to spin. That's actual vertigo. So true vertigo means there's sensation of movement when there actually isn't any. Then there's the lightheadedness when you're standing up. Did you get up too fast? Did all that blood pull in the legs and you start to feel some tunnel vision and you gotta kind of hold on to something for a second? You wait it out, whoop, it passes and you feel okay. You can also sometimes feel like you're sort of leaning, so I'll actually have people in the office who are kind of walking like this. Yeah, and they feel like they're walking straight until they start bumping the wall, and you kind of have to bump them back this way. So that's always, and then there's the idea that you feel like you're about to faint, or you actually faint. So syncope or pre-syncope. And people will come in claiming that they feel dizzy, and that's what they're feeling. And that actually usually means there's something going on with either the way the heart is pumping blood, or the arteries in the neck are not quite getting blood up to the brain quickly. And not always, but those are the things that we would start worrying about in those situations. And then of course, I've had people come in and say they're dizzy, and they have blurry vision, they have double vision, they'll walk into the tables, and they think somebody moved the table, but the table's always been there, they're just not seeing it clearly. So all of those things can be interpreted as dizziness, but they can also all equally contribute to kind of a multi-complicated system where your balance is just all inside out and upside down. I'm going to briefly talk about actual vertigo. So again, vertigo is when the world moves around you when it shouldn't be. So we're not at Disneyland on the teacups, a ride I cannot tolerate, it makes me want to puke. But it's, you're suddenly, everything just goes, and the common causes will be movement. So either you're laying in bed and you turn over and all of a sudden the world starts to spin, or you go to get out of bed and you have to stop for a second because it's, or looking down to tie your shoes. So usually some type of movement triggers it. The common ones by far is the first one. And that's called benign paroxysmal positional vertigo, aka BPPV. What each word means is benign means it's nothing serious. Now don't get me wrong, it will feel like we're gonna die when this is happening to us, it's miserable. But thankfully it brain is beautiful and healthy and all is well in the world, you just have a little kind of plugged up plumbing. And I'm going to talk about that specific condition more in detail in a little bit because it is so common and it causes a lot of stress for people. People get really scared or think they're having a stroke, and you're really not. You just have a little plug in your plumbing. So we'll talk about that one a bit more in just a moment. Meniere's disease is another pretty common condition. And I like to kind of explain it like it's a little bit of a high blood pressure in the inner ear. It isn't, but it kind of is. And the symptoms of that will be pretty classic. People will get a really loud, like roaring sound in their ear, and then the world will start spinning a mile a minute, and your hearing will take a bit of a hit. And that'll last sometimes several hours, which is miserable. And then eventually, your body takes mercy on you, and everything kind of starts to simmer down a bit. That roaring sound starts to go away, the room stops moving, and the hearing will often actually start to regulate. Over time, the hearing will usually kind of steadily decline slowly, and sometimes the balance will as well. Vestibular migraines and Meniere's, the first two, are very commonly mistaken for each other. Vestibular migraine is exactly what it sounds like. It's a migraine that affects the part of the brain that controls balance. So it makes you feel really dizzy. The dizziness will come on suddenly. You'll spin, again like you're on the teacups. Again, a horrible ride, I'm just throwing that out there. And you'll get a headache. The headache can come before the dizziness, it can come before the dizziness, and in very confusing cases, it can come not at all. And there are people that have vestibular migraines that don't always get a migraine. Riddle me that one. But the importance of trying to distinguish it when you go to your physician is because if you treat the wrong thing, you're never going to get any better. And normally, when you treat the migraines, the vertigo part of the vestibular part, the starts to go away. And it's the whoosh whoosh that actually causes at times a lot more distress than the headache. When you can't trust that the world is not moving, or you can't trust your kind of position in space, it's incredibly distressing. So when you meet with your physicians about your dizziness, it's important to bring up anything and everything that you may or may not think is relevant. Do you get headaches? Can you tell what's happening when it happens? Any symptoms at all that you've linked, throw it out there, because sometimes these things all look the same, and it's those little hints that will help put you in the correct diagnostic bucket so we can fix it. The fourth one, neuritis. This one basically means a virus acutely attacks your inner ear, and it can attack either the balance portion alone or the hearing and the balance portion together. This will literally make you feel like you're fine, eating your sandwich, shooting some pool, and all of a sudden, everything just goes, and it makes you violently ill. People will start throwing up. The dizziness will last for days. So at times when we're diagnosing patients, some of the most helpful things that we have is how long the episodes last. And that will frequently kind of start narrowing things way down. This one tends to last for days. People frequently end up in the ER, hospitalized, dehydration. Not always, but it's not infrequent. And then it'll just start getting better as the inflammation from the virus subsists or subsides. And we treat this if we get it early enough with some steroids, just because it's an anti-inflammatory. The most important part for this one is early therapy is paramount. And what I mean by therapy is physical therapy or vestibular therapy, which we would hear, everybody will hear more about later. Ballast therapy in general is really important for a lot of these conditions, but for this one in particular, the earlier you start, the better the outcome. Neuritis is quite common. I see it at least once a day, someone comes in with the condition, so it's a very, very common problem. The problem is by the time I see them, it might have been weeks or months since the episode happened. And they got better, but they're kind of stuck in this point where they're better, but they're not cured. They still don't feel 100%. Therapy will get you there, usually if this is the condition, but only if we kind of try to get you in there immediately. So a cerebellar stroke, and yeah, so if the brain has a bad day, the whole system starts to go downhill. Cerebellar stroke, like we talked about, the part of the brain that controls balance is the cerebellum, which is the back part of the brain. So it has its own unique blood supply. So if there's a stroke in that area, it happens just like a stroke anywhere else, but it affects those arteries instead. The symptoms aren't always as classic as slurred speech and weakness in a limb or things that immediately raise our antenna. They can be an acute onset of significant dizziness and vomiting and so on. And so if there's any other linked neurologic symptoms at all, that would be a good one to go to an emergency department. And that's frequently why the neuritis patients end up in the ER and they get a CAT scan is to rule out a stroke, because it can sometimes be a little tricky to tell which one's happening because the symptoms at the very beginning can mimic each other. So I just want everyone to kind of remember that one, because again, the symptoms, we're all very trained to think about symptoms of stroke, look out for it in our friends and family. But this one can be a little tricky because you may not, again, see the slurred speech or weakness or so on that would immediately raise your antennas. The last one, it's actually quite uncommon to cause vertigo, but I threw it in there because the patient population we're chatting with today, we're well aware of shingles, we get our vaccines and so on. Ramsay-Hunt syndrome is basically shingles in kind of like this part of the head and neck, along those nerves, and any of them. But classically, either the nerve that moves the face, so this is a cause of facial paralysis, well, people will think it's Bell's palsy, but it is not Bell's palsy, it's this. And again, different treatment, so if we treat correctly, better outcome. Usually linked to some blisters around the ear, not always, some pain, and occasionally some pretty significant dizziness. So this is where kind of bringing all of your complaints and concerns to your doctor are helpful, because you might have had a little rash around your ear and not thought anything about it, and then days or weeks later develop dizziness, and that rash could be the signal that it's actually shingles and not anything else causing it, so treat that and things get better. So kind of, again, when you go to the physician with these kind of complaints, just throw everything in there. Even if you don't think it may or may not be relevant, it can be very helpful. Alright, so I told you we'd go back to the plumbing problem. So BPPV is by far the most common cause of dizziness, at least in the practice on a day-to-day basis. It's treated with an Epley maneuver, which you're going to learn about in just a moment. Well, I think at some point. There's a fancy table here, I think, just for that reason. The Epley maneuver can be done at the doctor's office. I do it all the time. It can be done at your physical therapist's office. It can be done sometimes at your primary care physician's office if they feel comfortable, and it can often be done at home. What BPPV actually is, it's basically a plumbing problem. So I was told there's a laser here. If I laser anyone in the eye, I'm very, very sorry. It is not intentional. Okay, so this is sort of a blown up version of what the inner ear looks like. An inner ear area is located way deep in the head, kind of close to the base of the brain. This snail-looking thing over here is the cochlea, helps control hearing. It's kind of the junction between the outside world and your brain as far as hearing goes. And then its friendly neighbor over here, this is the vestibule. This is what controls balance, at least the balance that the inner ear is responsible for. It has a chamber in the center, two of them, kind of like a giant room outside in your community center. And inside the chamber, so there's little tiny otoliths, otoconias. They look like little crystals. It's like basically a glorified inner ear chandelier. And when your head moves in certain directions, these little guys move around, and that movement of them shifting around actually sends signals to the brain, tells the brain, okay, Christy just moved forward, Christy just turned, I slowed down, I sped up. It's that shifting around that tells them. Now, the brain and the body are just, they're brilliant. So they will recycle these little fellas, and they get absorbed in this area, and life moves on. Occasionally, however, these little guys will basically get lodged in these tubes. These tubes are called semicircular canals. There's 3 of them. They carry liquid. The liquid sloshes around when you move your head in certain directions, and it helps to also add information. When these little chandelier crystals fall into specifically this bottom tube, just because gravity is more likely to fall down, it kind of clogs this up. So now the normal movement of liquid that should happen freely can't. So it's kind of like, that's why I said it's kind of like a plumbing problem. Pardon me? Oh, I'm sorry. So it's a plumbing issue. And so the cure is to unplug this. Now the symptoms of this are going to be the classic. You're laying in bed, minding your own business, and it's time to get up. And you go to roll over, and all of a sudden everything goes. It doesn't last long. It can last 10 seconds to a few minutes. And then if you just sit there, you pray a little, because you really don't want it to last. And then it passes. There's usually no associated nausea or vomiting. People usually feel okay, but it can be very distressing because it can happen frequently. Sometimes it's just once in a rare while, but at times many movements will cause it. Again, looking down and tying your shoe, looking up to change a light bulb, looking over your shoulder to look in the side of your mirror. Those things can all trigger it. And so it can recur even after it's fixed, but once you know what it is and you know how to fix it, then you can either go back to your doctor and get it fixed or do the therapies yourself. It doesn't recur often, but it can. It does make life miserable. I promise you will not die, and it can be fixed. And then basically, it's just a bad plumbing problem, and it's fixed with a glorified plumber with an invisible plunger, and that's me. And so we do a series of exercises that move your head in certain positions to basically put this tube upside down, so put it up here, so that it can basically kind of let go of its plugged up thing. And so the exercises are done very safely on a table where you're supported and your head is moved in certain orientations to allow that to kind of remedy. Usually it'll make you pretty dizzy as the exercise is done, but then its efficacy is actually quite high. So very, very common. So if you're moving around in bed or tying your shoe and you get spinny, this can definitely be fixed. Do not suffer in silence. Do not get scared anything's wrong with you. Just go to your doctor or come see us or go see the therapist and we will fix you right on up. But it accounts for at least 2/3 of complaints with dizziness. All right, so other things. Now again, a bit outside my wheelhouse, but oh goodness. Okay, here we go. So lightheadedness. I get this one a lot in the office too. People come in and what they're actually complaining about is not truly vertigo or spinning or dizziness, but it's lightheadedness when standing. The most common is going to be orthostatic hypotension. This basically means your blood pressure and your heart rate don't quite keep up with what needs to happen when you stand up. I have this, diagnosed many moons ago. I treat it by wearing compression stockings. I buy them on Amazon. They're quite stylish. I don't have one on today, but yesterday mine had unicorns on it. And that alone actually often will fix this. However, make sure you're talking to your physician about any blood pressure medicines you might be on. At times, our needs change. We either lose weight, gain weight, change our diets, and medications that we were on in the past might not be relevant. I know we have our pharmacy colleagues here to review this. But I've had many patients come in on multiple blood pressure medications, and it's basically a blood pressure problem, and it's just too much medicine. So again, definitely talk to your physician, talk to your pharmacist. They're a wealth of knowledge. I call them all the time to go over that. Carotid artery disease, this is what I was talking about with the arteries in the neck. Don't quite send enough blood to the brain. These are especially something to think about if you're having syncope, so if you're passing out or fainting, or pre-syncope, you're almost about to faint, someone catches you. And that can mean that you're having some buildup in those arteries or some plaques, and it can be a precursor to a potential stroke. So that's something, again, important to bring up to your doctor. It can be diagnosed with simple ultrasound. The ultrasound will show there's a problem, and then it can get fixed if necessary from there. And then again, a bunch of heart issues. I keep saying it, if the ticker doesn't take enough blood to the brain, all kind of things start to go south. So perhaps we have atrial fibrillation, AFib, and the heart's not pumping enough, or heart failure, valve disease, aortic valve disease, and other things. So again, just stay in contact with your doc. If you're tripping, feeling unsteady, assuming like the rug's not actually built up, you could have neuropathy. So real common in diabetics and people with hypertension. So if you don't feel your feet very well, that can also affect your balance. So foot care, staying on top of that's important. But if you're getting the tingling and such, that means the nerves in the feet are not going to pick up the stability of the ground very well. So you might feel like things just aren't quite where you think they should be. Take your step, and if you can't feel your foot kind of really hitting, it's going to potentially increase the risk of falls and so on. Other neurological disorders, Parkinsonian syndrome, so Parkinson's and such will cause a very unsteady gait, shuffling, and so easy to get tripped on, and again, can also affect balance. And then there's the everything else bucket. Basically anything on the planet can impact your balance. From dehydration, we live in the desert, so dehydration here is something we all battle with, to nutritional status. So We sometimes get busy in life, we're not eating as well as we should be, or we're on medications that interfere with the absorption of certain vitamins. B12 is a common one. A lot of people are on acid blockers for long periods of time, and that can also impact the absorption of certain vitamins. So again, talking to your physician and your pharmacist about your medication and reviewing that list frequently is probably the most important piece of advice I can give anybody when it comes to balance. Prior alcohol abuse also, that can impact the way the base of the brain processes balance, so people that have a prior history of alcohol abuse can also sometimes be a little off. And then again, I keep going back to medications. We live in a society of polypharmacy, prescriptions for lots of things, and then side effects, and then you're taking a medicine to battle that side effect, and then a side effect of that, and before you know it, you're all off kilter more because of the medications that you're being given to treat other side effects. So again, checking back in with your doctor, making sure if you still need to be on certain things, checking with your pharmacist is something that I would highly recommend. So what to do? First things first, balance is paramount. Falls are a huge cause of suffering. And so if you're feeling like you're not as steady as you used to be, it is not a normal part of aging. And we tell people that, and it's just nonsense. There are ways for us to mitigate this and prevent it, avoid it, improve it, even if it's a little bit too far gone. Please don't accept that you just have to tolerate it or live with it. That is not the case. So visit with your physicians. And again, review your medications. I sound like a broken record, but talk to your pharmacist, talk to your doctor. You'd really be surprised how sometimes things we take to help us actually start to cause some trouble. Have a really thorough examination by your primary care doctor to make sure it's something that's not just vertigo, that it isn't an artery problem or a foot problem. If the room is spinning when it should not be, then the inner ear is probably the problem child. And come see me or any, ENT. We will likely end up doing a good exam on you, talking to you for a while to get the full story, potentially, if necessary, ordering an MRI of the inner ear, doing some balance testing, a hearing test, because like in that prior picture, the hearing organ is neighbors with the balance organ, so they can kind of be a hint. And then oftentimes vestibular therapy, so physical therapy for the balance system. It's a wonderful thing, we should all do it from time to time. I've been through at least twice, just because who doesn't need it? And it just kind of keeps you dialed in and checked. It's such a complex system that it's very easy for it to occasionally derail just slightly, and then before you know it, a mild problem becomes a bigger. For me, it was I couldn't swing on the swings with my kids anymore and look up without feeling like the whole world was spinning. And at the time, I was like 30 years old, which was ridiculous. So I went to therapy for like 8 weeks, got better. And then about every 5 years, I kind of go in and visit. So I've been now 3 or 4 times. So I highly recommend it. Treatment. Prevention is key. Keep an eye on your blood pressure, keep an eye on everything else. Medications can be used for vertigo for an acute attack, but they can delay recovery. I'm not going to touch on this because the pharmacist will. Therapy, once again, here, I think I just blinded someone, I'm very sorry. And then visit with your doctor to treat any underlying, like cardiovascular disorders or anything like that. So, any questions? All right, well, I really appreciate your time and the opportunity to chat with you guys. If you guys ever have any questions, I think we have business cards out somewhere, so feel free to call us and we'll be happy to help you guys kind of navigate this. But again, the most important thing I can tell you is check your medication list and do not accept balance problems as a normal sign of aging, okay? Thank you so much. I really appreciate it. Thank you guys. Have a good one. Happy holidays.
All right, now we're going to bring on Dr. Hitzman, our eye doctor. And she's going to introduce herself as well, a little bit about her practice and etc. Thank you.
Vision and balance. So we're going to start with this lovely picture because that's where I'm from. I'm from Honolulu, Hawaii. Very proud to be from there. Are you as well? Nice. Right on. Hawaiians in general love Las Vegas. We call it the ninth island. So a lot of us visit every year and some of us stay. A little about my education. I have my Bachelor of Science degree in biology from Michigan State University. Go Green. And I graduated from the Southern California College of Optometry. Did some clinical externships around the country in Bethesda, Maryland, and Amarillo, Texas, and then at the Center for the Partially Sighted in Santa Monica. And I'm currently a partner in the Visual Performance Center of Nevada. A couple of subspecialties there. One is called low vision. Low vision is vision loss that can't be corrected with typical glasses, contacts, or surgery. Some of our patients have strokes or macular degeneration or congenital issues where they need higher forms of magnification or different devices to help them drive or read, things like that. And then another really exciting aspect of our practice is called myopia management. So myopia management is slowing the progression of myopia or nearsightedness in children. It's something we didn't used to be able to, we weren't able to do in optometry, and now we are, so it's pretty exciting. So let's dive right in. We're all here today to talk about balance, and I'm here today to talk about vision and balance. So there are three main information systems that we need to incorporate in order to have good balance. One is the visual system, visual meaning information get through sight, our proprioceptive system, so information gathered from muscles and joints, and so we have our PTs here, and vestibular system, so we talked about that a little bit as well, inner ear, sensing motion, equilibrium, and spatial awareness. And a deficiency in any of these systems can result in a loss of balance. So the relationship between the visual and the vestibular system begins at birth. So when we're very young, movement guides vision, and the reason for that is the visual system is not complete when we're born. Part of vision is learned, and that's one of the reasons it's really important for our kids to get eye exams. As soon as we develop the necessary visual skills, however, vision then is able to guide movement, so they're very interconnected. There is something called the vestibulo-ocular reflex, and this is a key way that vision impacts balance. So it's coordinating eye and head movements, and I'm going to demonstrate that with you all. So I'm going to have everybody look up here at my hand. Okay, perfect. And while you're looking up here at my hand, I want you to move your head slowly from side to side. And what you'll notice while you're doing that is when you move your head to the right, your eyes move to the left, and vice versa, without you even thinking about it. That is called your vestibulo-ocular reflex. And so if we have a disruption in that reflex, maybe to a traumatic brain injury, it can result in dizziness and people can lose balance easily. I liken it to watching a TV show where the sound lags behind the picture by about a second. So you can see the picture and you can hear the sound, but when the two are out of sync, it can be very confusing, it can be very annoying. It can be, yes, everybody's kind of nodding, everybody knows what I'm talking about. My patients with dysfunctions in vestibulo-ocular reflex will say, you know, while I'm walking down the street, I can't identify faces or I can't see street signs. And the reason for that is without those compensatory eye movements, as their head moves, everything in their vision is bouncing. And so they have to stop in order to be able to read street signs or recognize faces. So this can be a tough one. I'm going to talk to you about some common eye diseases that impact your vision and therefore can impact balance. So the first one is macular degeneration. It's the leading cause of vision loss in people over the age of 60. Very common. so sorry. Yes. Okay, thank you. The effects of the sun are cumulative, meaning they add up over your lifetime. And so I recommend sun protection for all of my patients. Next are eating green leafy vegetables. So veggies like kale and spinach and Brussels sprouts, those are great for the health of the retina. There is a triad of nutrients. One is called lutein, one is called zeaxanthin, one is called mesozeaxanthin. And that triad has been shown to increase macular pigment. Pigment is protective, so the higher the level of pigment in the back of the eye, the better to prevent macular degeneration. And then finally, quitting smoking. If some of you are smokers out there, this is a great reason to start to cut back and ideally quit. The next eye disease I want to discuss is called glaucoma. So glaucoma is a group of eye diseases that cause damage to the optic nerve. The optic nerve is the nerve in the back of the eye that connects the eye to the brain and transmits information. When the pressure inside our eye gets too high, it can cause irreversible damage to this nerve, which can result in peripheral vision loss. So you'll look up here at this photo where it says normal vision, you look at that landscape, and you can see it in its entirety. Somebody with early glaucoma will have barely detectable vision loss, and sometimes they don't notice it at all. When we get to the advanced and extreme, or what we call end-stage glaucoma, oftentimes patients are left with tunnel vision and then eventual total vision loss. So glaucoma is a kind of a scary one because as patients, you don't notice any symptoms of it until it's very well progressed. Fortunately, as eye doctors, we can identify the signs and risk factors years before it'll affect your vision. It's a really important reason to get regular eye exams. Another common one is called diabetic retinopathy. So diabetic retinopathy is a common complication related to diabetes. Elevated blood sugar damages the blood vessels in the retina. So if you look at this photo, oops, I'm so sorry. This photo right here, that's the retina, that's the lining in the back of the eye. And you'll see these splotches here. That's leakage or damage, bleeding in the back of the eye essentially. And when you have bleeding in the back of the eye, it can result in splotchy vision, so blind spots. And you can imagine how that can impact your balance as well, depending on where those blind spots are. I also want to talk to you about cataracts. So cataracts are very common. If we live long enough, we will all get cataracts. So age is the #1 risk factor to cataracts. Cataract is a clouding to the lens inside the eye. Other risk factors include sun exposure. Again, we get a lot of sun here in Nevada, so another reason to wear sunglasses outside. Diabetes, again, that's related to cataract formation. We see an earlier onset of cataracts in our diabetic patients, and diabetics progress more quickly in patients with diabetes often. And then also smoking. So smoking is related to cataracts as well. You'll see right here on the left, somebody with normal vision will take a look at this photo, and they'll see the corners and the edges of that flower, and they'll also see the details and the vibrant colors. And someone with cataracts, it's like looking through a cloudy film, and that's because the lens inside the eye is cloudy. And as a result, you don't see colors as well, and you don't see definition as well, and details as well. A lot of my patients say to me, I'm having trouble driving at night. Glare around lights at night is becoming more difficult for me. And that's typically one of the earliest signs of cataracts. There's something called an anti-reflective coating that we can recommend if patients are struggling with night glare that oftentimes helps with that. Vision and falls, I just want to touch on this and its impact with balance. So vision is a neglected area in fall prevention. Some of the recommendations I have. 1, get annual eye exams. So not just to make sure that you have the most up-to-date glasses that you see as well as possible, but also so that we can screen for eye disease and look for risk factors and identify signs of different eye disease for you. Next is to wear prescribed glasses. I hear this all the time. So my patients will say, I'm having trouble driving at night, and I'll say, are you making sure that you're wearing your glasses? And they'll say, no, I don't wear my glasses for driving. So, well, especially driving at night. So wearing glasses, if they're prescribed for distance, you should be wearing them, especially when driving at night. And then keeping them clean. My husband is famous for this one. So he works out in his glasses, and, works in the yard and does all this stuff, and his glasses oftentimes are it's almost like he's looking through a cloudy lens because he is. It's almost like he has a little cataract there. So making sure your glasses are clean. Also, timely cataract surgery. If you've been told that you have cataracts and you've had a recent fall or a loss in balance, or you feel like you've almost fallen, even if it hasn't been a year since you've seen your eye doctor, maybe it's time to go back. Cataracts ripen or mature at different rates, and so you may have a friend that has a very slowly progressive cataract, but you may have a quickly progressive cataract. And so if you find, if you feel like, I'm not as steady as I used to be, and I've been told I have cataracts, it might be time to go back. And then sunglasses, we've already talked about this. My favorite sunglasses are called polarized sunglasses. So polarized sunglasses cut out all the damaging UV rays that contribute to things like cataracts and macular degeneration, but they also reduce glare, so they're really nice on a Las Vegas afternoon. Like I said, polarized sunglasses slow cataract formation and reduce your risk for macular degeneration. So that's all I had for today. I'll be around for questions afterward. Again, my name is Dr. Amy Hinson, and excited to be here. Thank you for having me.
All right, next we'll have our pharmacy from Summerlin Hospital come down and talk about medications and their effect on balance. Just testing out, just to make sure I know how to use this clicker. Hello everyone, how are you? Are we still alert, awake? Yeah, I'm a little soft-spoken, so if you can't hear me, let me know. A little intro, my name is Tan, I'm a pharmacist since 2014. I went to a local pharmacy school here in Henderson and started working for a large chain pharmacy since 2015. I've been with Summerlin Pharmacy as an inpatient pharmacist. And so if you have paid us a visit, most likely myself or one of my colleagues have worked behind the scene with your nurses and your doctors to make sure that the medications prescribed to you and for you are safe, appropriate, and get to you in a timely manner. On the same topic of the importance of balance, I'm going to talk about medication that could alter it. Medications are really helpful and sometimes necessary in our daily lives to improve our lifestyles, but they do come with risk. And one of the risks I'm talking about today is the risk of these medications to cause falls. And it is important to emphasize this and to raise awareness because according to the CDC, every year about 3 million older adults check into the ER as a result of falls. And about 300,000 patients end up with hip fractures. So falls are something we want to minimize, reduce, and prevent. So knowing your medication, not only why you're taking them, how you're taking them, but knowing the side effects so that you are more aware and you're more prepared to take them safely is very important. The CDC also came out with a fact sheet or a flyer for you. I'm going to pass it around when Rob, my partner here, is talking, so I'll pass it around for you. because our visit here is brief, we're just going to, we have selected a few classes of medications that are on this high risk profile. So one of the, this table lists some of the high risk medications. And one of them is a group called NBRAs. It's just an abbreviation for non-benzodiazepine receptor agonist. These medications bind to receptors in our central nervous system in the brain that can reduce alertness, slow down your movement and reactions, so therefore increase your risk for falls. And the side effects that are commonly known when you use them are confusion, decreased alertness, dizziness, and of course loss of balance. And three of the most common medications are Ambien, Sonata, Lunesta. These medications are often prescribed for sleep and because of their sedative effects. Ambien in 2019 have been issued a black box warning. That's the highest warning by the CDC with FDA because of its risk for residual sleepiness. So people that are on these medications, especially at higher doses, have reported sleepwalking, sleep driving, doing normal daily things the day after taking these medications while our brain and our body still sleep. So, most importantly, if you're on these medications, they are only prescribed for short-term use, as needed only. Ambien is really fast-acting, so you should only take it right before you go to bed with an anticipation of a full night's sleep. So if you're not going to have a sleep throughout the night, you may not want to take that. Sedative medication, it's important to not combine them, not only prescription medications, but medications that you can just pick up at the store. A lot of sedative medications are the cold and flu, cough syrup, things like that. And a lot of time it's not very noticeable on the label. So if you're unsure, if you're on one of these sedative medications for sleep, make sure you're picking up a script and consult your pharmacist there. Also, we want to avoid alcohol, medication, drinks that cause further drowsiness. Okay. Like I said, Ambien is really prescribed for short-term use. So if you have trouble sleeping and you need longer-term sleep management, discuss it with your doctor. Maybe Lunesta would be a better agent. It's more efficacious in long-term management. So understanding your medication, understanding your need, and discussing it with your doctor. Another class of medication, and again, according to the CDC, our older population, at least 65 years of age and older, 75% have used or are currently using opioids for pain management on a regular basis. And our list is long, but it's not comprehensive, so if you don't see your med that's up there, and you have questions, please let us know or talk to your doctor or your pharmacist. They'll be more than happy to go over them with you. Some of the common ones on my list is the hydrocodone, that's in your Vicodin, your Norco. The oxycodone can be combined with Tylenol in your Percocets. And then I've seen some higher potent opioids like the hydromorphone and the morphine in the inpatient setting. Any questions so far? I know I'm going really fast. Next up on my high risk of medication that could cause falls and alter your balance is the benzodiazepine. Previously, we covered the non-benzodiazepine medication for use for sleep. These ones have a greater variety of treatment. They're used to treat anxiety, depression, muscle relaxation, seizure, and some of the common ones are the alprazolam, lorazepam, temazepam, and if you can tell from the brand name of temazepam, Restoril is normally prescribed for sleep, can also help with anxiety. So you have combination, if you have anxiety issues and you have sleeping issues, discuss it with your doctors. Maybe we can combine these, take one med for multiple indications so that you're not adding on medication. It reduces your risk of sedation. And in this list, oxazepam is not listed, but there are preferred agent in this class for the elderly, and those are summed up as we normally know them as the lot: lorazepam, oxazepam, that's unlisted, and temazepam. And they are preferred agents because of the way that they are metabolized and eliminated in our system. They are fast acting, but they get excreted quicker, so we're not at a higher risk for prolonged side effects when we are on them. So again, it's the lorazepam, oxazepam, temazepam. So I'm going to give Rob a chance to speak, but the main point I would like to emphasize is know your medication, identify the ones that put you at a higher risk so that you can talk to your doctor. You're more aware when you're taking them. Okay? And here comes Rob.
Good afternoon, everyone. I don't want to bore you guys out with my talk, so just to wake you guys up. So the list that I'm going to go over, so I'm going over antihistamines. Majority of the time, I see this prescribed for sleeping. A lot of it is for itching. If you have some sort of anaphylactic reaction, or if you have anxiety, this could also be used. The reason why I think this is pretty important is because this medication is readily available, that's over the counter. If you ever go to your grocery stores or any like Target, Walmart, they do have these available. Two of them are available that's over the counter. One of them is going to be the Benadryl or diphenhydramine. The other one is going to be the cetirizine or Zyrtec. The big difference between these two is Benadryl, which is considered the first generation, crosses the blood-brain barrier a lot more, so it causes more frequent sleepiness or grogginess. That's why it's mostly used for sleep. It's not recommended for anyone at 65 and over to be using this for sleep, and just as needed. Atarax, on the other hand, it could be used for anxiety as well as sleep, and that one is only available that's prescription only. There are other antihistamines out there, such as loratadine, levocetirizine, or Allegra, but those ones don't cause as much drowsiness in comparison to the ones I listed here. And then we do have the sedating antidepressants. As you can see, the list is not that long, but there is a lot of them out there. These medications, such as trazodone and mirtazapine, are mostly used for sleep. It's an add-on therapy along with any mood-stabilizing medications. A lot of these medications, we typically want you to be out and not moving around for about 6 or 8 hours. And the reason for that is it takes a lot longer to be in the system, and it's also dependent on individual. is all the lists that I have. Majority of these medications we couldn't list, such as that we mentioned is like your hypertension medication for blood pressure. A lot of them, if it does work too well, you will get a little bit of a dizziness effect. Some of them, when you get from a sitting position and standing up real quickly, as mentioned earlier, you do get hyperstatic or orthostatic hypotension. If you do have questions regarding those medications or anything like that, make sure to reach out to your healthcare professional or pharmacy will be able to assist you with it. And my best suggestion when it comes down to these medications is have a list. If you are checking your blood pressure, you're checking your glucose, make sure to have a list of the medications along with all your levels so that you can readily present them to your pharmacy or your doctors.
Okay, what I'm going to do instead of holding the panel, does anyone have any questions for our pharmacists while they're up here? I'm going to have you ask now if you can. Any questions at all you guys want? Just raise your hand. Someone? Ocuvite, did you say?
For the vision. It's pretty much to help with the vision. It's got, it's pretty good, but one thing with those over-the-counter medications and herbals, it doesn't go through federal testings, so it doesn't really get approved. So we don't have any testings that tells you whether it's efficacious or not. But Ocuvite, as well as there's another one that's over-the-counter. Preservation, yeah, they have a lot of vitamin A with it. And vitamin A does help with vision. Yes.
Yeah, I don't take Advil very often, but when I do, I always get really sleepy for about 3 hours. I was talking to a healthcare person, and they said you might be mildly allergic to it if it brings on sleep. Do you know anything about that?
That is very odd because it doesn't touch upon the sleeping pattern when it comes down to Advil, because it's ibuprofen. It's mostly in the kidneys. When it comes down to that, it's not considered an allergic reaction or an allergy. It's not a true allergy. It's more of an adverse effect. So there are some paroxysmal medications that would cause something that's very rare, and I think that's one of them.
Any other questions?
How about taking Pimasol or Latanic rest for the eye? It's all good? I want to make sure it's all good.
So with those medications, some of them are gel forming as well as the ones that are just gel in particular. My best suggestion is once you apply it, if it is gel forming, give it some time because it does blur out your vision. And when you blur out your vision, obviously you're going to lose balance easily.
But it doesn't mean balance.
Yes, it contains a balance because it does help with the glaucoma and pressure in the eye.
But it doesn't help you balance.
Oh, balance-wise, no.
All right, you guys, I'm gonna have, does anyone have any questions for Dr. Hitzman before she goes? I don't want to hold her up either, so for our eye doctor, if you have a question, just raise your hands, I'll come over and, anybody? For the eye doctor? Okay, thank you, Dr. Hitzman, for your time. So next, our final, we'll have 2 minutes left. Our final presenters are Summerlin Hospital's physical therapy. They're going to do some demonstration as well as a PowerPoint, and then we'll hold questions till the end as well, okay? Thank you for your patience.
Hello, thank you for having us. The presentation will be brief. We're going to talk about the somatosensory system, balance, ways that you can strengthen your balance. My name is Lisa Patterson. I'm the manager of the outpatient therapy department at Summerlin Hospital. I'm also an occupational therapist. And I have here Ratia Bong, who is a physical therapist at Summerlin Outpatient Therapy. Hand it over to Ratia.
All right, my to start off with a little story. Imagine it's cold and dark outside. It's 6 o'clock in the evening, Christmas Eve in fact. You're going to have dinner with your friends at your favorite restaurant. As you walk up towards the curb, you step over the curb, but then your right foot catches it, and you're on the ground. Immediately, people come up to you and say, hey, excuse me, are you okay? Do you need help? But you can't get help. You can't even move because you shattered your femur. Yeah, and now you have to wait for the paramedics to come. Worst of all, you can't even have that juicy steak that you wanted.
Okay, so some facts about older adults and falls is every 20 minutes an older adult dies from a fall. 1 in 4 older Americans fall every year. Older adults who have fallen have twice the chance of falling again, and 1 in 5 falls results in a head injury or broken bones. $744 million is the total amount spent on acute hospital charges associated with the falls in 2014. This is a very grim presentation, but I promise it'll get better. So, what if we don't change at all and something magical just happens? As you see, the profits and sales are down.
All right, so we're going to talk about the somatosensory system, which is basically our receptors in our body. Every joint, we have a series of receptors, and it reacts with our brain. So if we're standing on 2 feet, we have more reception going on than if we stand on 1 foot. Now it's more compromised. Now our somatosensory system is more challenged. It's in there where people will lose their balance the less senses they have. Or also if you combine that with having issues with your eyes or your vestibular system, you would talk to with your ENT. So we're just going to go over some exercises that you can do. And courtesy of Sherry, she gave you all some TheraBands, and I'm going to have these over here demonstrate these exercises. So the first one is TheraBand hip abduction. It's very important to work on your core. So you can go ahead and hold on to this, Lisa, right here, if you need it. So she's going to be standing on one leg, and simultaneously she's going to be extending that left leg out to the side to work on those legs to get those stronger. Okay, this is also challenging her core and working on her balance. The next one is TheraBand hip extension. Standing up straight, instead of bringing the leg out to the side, she's going to bring the leg straight back. Okay? This is going to help with promoting leg strength, getting that hamstring a lot stronger.
One side will be harder than the other, but you'll hold on to a chair too.
Yes.
I really hope I don't fall, that would be really embarrassing.
Okay. Next is dynamic hip abduction. So she's just going to do some side steps for about 3 feet to the left and then 3 feet to the right. You do this for about 1 to 2 minutes, and after a while, you're going to feel a good little burn on the side of your hips. Most people, when they fall, they don't fall forward or back. It's usually to the side. Usually people have really good strength in their quads and hamstrings, but poor strength in their hip abductors. So this is an excellent one.
Feel it already.
The next one is a bridge with a TheraBand. So this one, the person is laying in a face-up position. Both knees are going to be bent. You could do a regular bridge without the TheraBand, or you could do it with it. The TheraBand is just going to add more challenge to it. So working on hip extension here. It's really important for bed mobility skills. A lot of times when I see patients, they can't even get up out of bed. They can't do a proper log roll. They can't go from a supine to a sit-up position. So this is a very important exercise to do. The next one is hip abduction on the table. So you can just leave the band in between your knees there, and just going to spread the knees out. The band's going to apply resistance to you. And again, this is going to help stabilize your hips so that when you walk. So if you know anyone who uses a front wheel walker, it's because they have poor hip stabilization. This would be an excellent exercise to use. And then if you're doing these exercises in your house, and your neighbor walks by and looks through the window and sees you doing them, and asks you, wonders what you're doing, you can say that you've been working on your core. Then we have the resistive hamstring curl. So she's going to lay face down here. One leg's gonna be straight, the other leg's gonna be bending the knee, okay? Getting some good strength in the hamstring. This one's important just so that you have some good looking legs. Then we got back rows. All right, come on over here, Lisa. So back rows, balance, a big part of balance is actually posture. So if you're forward hunched, and I get a lot of people in the clinic, when they come in like this, all bent over and forward, and the reason they're like that is because they're afraid of falling backwards, so they're actually really hunched forward like this. So this exercise is to promote your posture and to get that strength back. So for here, with your bands, you could tie your band up to a door, so I'm gonna pretend I'm a door, and I'm just gonna do some back rows to work on the posture. Basically just squeezing those shoulder blades all the way back. You're gonna hold that for 2 seconds. Don't cheat, Lisa. Okay. 2 reps of 10, and you should have some exercise handouts. It should say 3 sets, 10 reps, do it 3 times a week. I provided that for you guys. Then we have trunk rotation right here. So basically just stabilizing against the door, keeping your core nice and tight while rotating. Important for like getting groceries, moving it from your counter into your refrigerator. And then the last one I put is a golf swing, since we're surrounded by golf courses here. So just working on the swing. Just gonna keep everything nice and stable there. Just go a little bit slower. It's not about speed. It's about strength and stability. There you go. So for physical therapy, I can help you with this particular exercise, but I can't help you with your golf score. So, sorry about that.
Okay, so we are located, outpatient therapy is located at Summerlin Hospital. I hear a lot that people don't know that we're there. So if you do need physical therapy, your doctor recommends that no matter where they refer or what the referral says, you have a choice to go to whichever physical therapy you would like to go to. So here the waitress is given a choice. You have a choice of 3 bean salad or lethal injection. All right. Thank you very much. And if you guys have any questions.
And Richie, just a quick question. With those resistant bands, I think, are the different colors representative of the different strength of the band?
So she asked if the bands have a different resistance, and yes they do. So with the varying color, the lighter the color, the least resistance it will be, and the darker the most. So it goes, we have yellow, green, and blue in that order. They come in a loop, so if you want to, you could cut it to make it longer and do those door exercises.
If you have your surgery, you need to have therapy after that. Can you go anywhere you want, or
Yes.
2 hospitals they talk about, you can go to wherever they are.
Absolutely. So
You can go wherever you like.
Her question was, after surgery, can you still go wherever you would like for physical therapy? She's given a choice of 2 hospitals.
They're telling me 2 weeks.
Okay, so for in-house, if you're getting therapy in-house, there are a few inpatient rehab facilities. We're outpatient, so once you go home and you need to come to therapy 2 or 3 days a week, that's the outpatient therapy. So if they're giving you a choice for in-house, there's only so many in town in-house, but then afterwards, outpatient, you could go to whichever clinic you would like. Does that answer your question? Okay.
Any other
Anything else?
questions?